Hi, I'm Dr. Craig Tuttle. Welcome to my office. Today we're going to talk about spinal decay. It's a real popular subject and a lot of people are concerned about it because so many people suffer from neck and back problems. But first I want to talk to you about what normal looks like on your spine, and then I'm going to show you what abnormal looks like. And so first of all, this is a kind of a context model of different stages of decay that we all go through if we don't manage our spine properly. This is a textbook normal here. We're looking at the vertebrae here. These are the actual individual segments of the spine. Each one is called a vertebrae. There's 24 total in your spine on average. The pads between the bones are called discs. They're 70% fluid-filled pads that act as shock absorbers between each of your interlocking 24 vertebrae. And this is phase 1, what we typically would see on a 20-year-old person. This is phase 2, which is a typical 40-year-old person. And then again, phase 3 here, which is a typical 60-year-old person. And these are the typical wear and tear patterns we'll see on average by age if the spine isn't kept in alignment and kept mobile. We'll talk about how to prevent this decay in a second, but just wanted to see this, let you see the averages that we'll typically see in neck and backs over time from neglect, from not managing it. Just like teeth, if you floss and brush your teeth, they stay quite healthy, and when you go in to get your checkups, you see your hygienist and you're managing your teeth, they stay really healthy if you're consistent and you manage it properly. Well, the spine is just like teeth. If it's managed properly, it will stop degeneration and decay, and that's our objective, is to stop that degeneration and decay. Let's take a look at normal. Normally when you look at the spine, it should be springy, and I'm going to set this model down here. When you look at a spine, the bumps on the back of the spine are called the spinous process. Now, the most important part of the spine are these two little hinges on either side of the spine called facet joints. And that's where all the mobility occurs on a spine. So when we bend down to tie our shoes or to pick up a bag of groceries or to play a sport, that type of thing, we're dependent upon not having nice, springy, elastic, intersegmental movement between the interlocking vertebrae. They're just like hinges on a roof. They overlap each other and they allow mobility to occur. Over time, from poor posture and emotional tension and even chemical stress in our life, the muscles and ligaments around those hinges start to tighten, and that causes restriction of mobility. And if that restriction isn't unlocked and stretched, and those muscles and ligaments that hold those hinges together aren't kept flexible, over time they get more and more stiff. That's why as we age, we start to get more and more tight, leading to a condition called osteoarthritis, or degeneration of the spine. So the key is the old saying is to move it or lose it. That's so applicable in our lives. Just like brushing and flossing your teeth, you want to keep these joints mobile by seeing a chiropractor to make sure those hinges are kept unstuck. And that's what we do as chiropractors, is to evaluate the functional mobility of those hinges to make sure they stay loose and mobile. So the average person by phase 1 starts to get less mobile, and the hinges will become more stiff and tight. The disc or the pads on top will start to dry and crack, typically by about age 20. And then by age 40, those hinges now become more and more stuck and less mobile. You'll see that now there's a decay process. You'll see the body will start to develop calcium deposits on the edges of the bone called bone spurs, and around the facet joints, these little hinges will start to become more decayed. The second thing is the disc or the pad between the bones will start to degenerate and become quite thin and can even bulge or start to protrude out to the side, thus a bulging or herniated disc. You'll also notice the nerves are going to start to get much smaller in diameter as compared to initially where they were thick and more rounded here. So this is the average 40-year-old we'll see. By age 60, the spine, usually by then, if it's been neglected and hasn't been managed, now the bones will start slowly locking together. They call that a fusion, or like a permanent locking of the vertebrae. We have a tendency to have a hard time bending or turning our head a certain direction. All the body's starting to calcify together, and the disc will dry up like raisins, like a raisin. It'll start to become very dehydrated and dry. And then the facet joints will start to literally fuse and lock so that the spine becomes very limited. And lastly, the nerves will become very thin, much like a piece of floss. The thickness of the nerve will actually start to degenerate, weaken the quality of messages being sent through that nerve tissue. There's many references of this, documenting this scientific proof of subluxation degeneration, which is a fancy word meaning the joints become stuck. causing the spine to degenerate and decay. That's a little bit about spinal arthritis and spinal joint decay. And we want to keep our spine mobile. A chiropractor goes in and physically feels where those hinges are stuck by their hand and then unlocks or moves the bones to free them up. Kind of like when you get your teeth cleaned. It keeps your teeth feel good after they've been brushed and flossed, or you see your hygienist to get a cleaning. When you go to see a chiropractor, so many people are thrilled about seeing a chiropractor because they get their spine unstuck. They become more functional, more mobile, more effective in their lifestyle. And it helps with their sports and their work and all the activities they want to do. So that's a little bit about our spinal arthritis today. I want to thank you for coming to our office and learning about that today. If you'd like to have an initial examination for free, we offer a discounted coupon on our website where you get the initial exam for free to see if your spine is starting to develop any arthritis. And again, we do that for free, but you need to go to our website. That's yourseattlechiropractor.com. Thank you for stopping by today.